Welcome to the podcast. Today, Dr. Dave Jerome and Dr. Paula Slaney join us to preview the Canadian Association for Wilderness Medicine Annual Conference, running September 11th through the 13th in Whistler, British Columbia. Providing clinical care outside the formal system requires highly specialized training. In this episode, we explore the event's multidisciplinary CME itinerary, featuring hands-on workshops for remote point-of-care ultrasound, alongside main stage sessions on high Arctic dive operations, severe frostbite protocols, and physiological considerations when engaging in mountain recreation. Beyond the clinical curriculum, we also discuss the abundant networking and extracurricular opportunities Whistler offers, from mountain biking to backcountry hiking. Available in person and via a hybrid platform, this conference is an essential resource for any provider operating in austere environments.
What should I do if my Sherpa is trying to scam me?
Yeah, we're not touching that one, Jordan.
Please note that Major Jerome is participating in this episode in his personal capacity. The views and opinions he expresses today are entirely his own and do not reflect the official policies, positions, or endorsements of the Canadian Armed Forces.
So for any of the enthusiasts out there, maybe they're not actually working in an emergency scenario, or maybe they're just out in the backcountry recreationally, what actually is wilderness medicine? How would you sum that up?
So wilderness medicine, it's a growing subspecialty of mostly emergency medicine. And it's something that's actually been really well established internationally going back a number of decades. But it's a relatively young subspecialty here in Canada. And that's one of the things that's really so exciting about being involved with CAWM and being involved with wilderness medicine, especially, is that because it's a growing field and a maturing subspecialty, there's opportunities to really get involved and help shape it in our Canadian context. But what it actually is a combination of providing medical care outdoors, usually in austere environments, but outside of the formal EMS system. There's also a research component that goes into it in terms of just understanding human physiology and human illnesses that happen in outdoor environments and environmental injuries. So think like frostbite or heat illnesses, things like that. Your wilderness and environmental medicine doctors tend to be the experts in those subjects. And then there's a advice or travel advice component as well. So people who are either healthy or have chronic illnesses who are looking at going to extreme environments, like they want to take up diving or they want to go to high elevation, for example, there's an assessment and an advice component of advising them how we can support them achieving their goals going out into those extreme environments.
So not just practicing in a low resource setting, but like the very specific types of injuries, types of pathology we might come across, and then as well kind of the preventative aspect. How do we keep ourselves from getting into trouble in the first place?
Absolutely.
Yeah, so it's quite exciting from that point of view too. A lot of people think of wilderness medicine as you have to be, 80, 100 kilometers in the back country. But the reason why it often falls under family medicine and emergency medicine is you don't necessarily have to be in austere environments to be the expert in this area. So as Dave mentioned, so frostbite, avalanche rescue, hypothermia, hypo. We see this in endurance athletes. We can see this even in inner cities. So a lot of the wilderness medicine is also the environmental medicine, and that's where a lot of the expertise comes in as well.
And then when did the CAWM, the Canadian Association for Wilderness Medicine, when did this actually come together to start supporting these providers, these people in the environment?
I'll let Dave take this one because he actually founded CAWM, so he was there when it started.
Yeah, so I was one of 6 people who came together and started the organization. It's a relatively young organization that was founded back in 2020, so like peak COVID, to put it into context. And we were, there's a group of Canadians who kept meeting up at international meetings because we were involved in the community, but we were only really interacting when we would go to these international events or participate in international bodies. And we had been talking for a number of years about, have we reached the point where we have a critical mass of interest and people involved that we could support having our own Canadian, our own national organization. We were going back and forth about that and looking at the logistics of how to set it up. And then COVID happened. And actually, I don't think CAWM would have started if it wasn't for COVID, because in the first year of COVID, no one had really figured out how to do CME. And it took a little while for a lot of the big national organizations to pivot, to go from in-person conferences and in-person CME events to transitioning to online only CME. And this created a big gap where medical providers were still expected to get their CME credits and participate in CME events, but there wasn't a lot being offered. And we realized there was a big gap in the market, but also the barrier to entry to host a virtual conference was much less than it is to host an in-person conference. So we were thinking, like, this is, a disruptive event, which is creating an opportunity for us to be able to reach people who normally are in the routine of always going to the same conferences or the same couple of conferences, but now everyone's looking for something new, and maybe we can offer them something that's new that meets their need for CME, but is also going to be interesting and really valuable. And so because of that opportunity, that's why we decided to launch CAWM in 2020. And then it's just been building up steam from there.
That's interesting. That's cool that it was kind of the catalyst and made the accessibility virtually more available. That's very interesting. Going locally, like bringing our own association here, what does that open up in terms of the types of CMEs, the types of educational content you can put in there? I mean, we've got no shortage of wilderness and exposure hazards here in the country. I imagine there's some local flavor to it.
Yeah, so absolutely. It's been really great. As Dave had mentioned, we were trying to find this critical mass. Interesting enough, Dave and I ran into each other at a conference in Salt Lake City, Utah, the American Wilderness Medicine Association, their conference. So we realized that we have a lot of assets here in Canada, and we just need to bring them all to one place. So we have like some of the leading world experts on frostbite care. We have some of the greatest academics in dive physiology in our country. So CAWM was able to make this incredible network of people to bring them to one place at the conference. And that has actually led to numerous other opportunities for CME for networking and research. So we do like seminars as well and other like workshops and opportunities like that within the country for additional training in the field of wilderness and environmental medicine. So it's been really incredible to see all of it come together we're only in our 6th year, right? So in a very short period of time.
And how have things evolved since the in-person options started opening back up again and actual physical gatherings are now, we've come a long way since the dawn of COVID when this all got started.
A lot of organizations I've noticed have gone back to only in-person events. Because there's a lot of value in meeting up in person and the networking and the connections that happen around the lecture. And so I understand the value of trying to emphasize those connections. And as an organization that hosts an annual conference, I also understand why logistically it is infinitely easier to only host an in-person event as opposed to having to coordinate a hybrid event and support both forms of learning. But CAWM has committed so far to keeping our hybrid format. And we're always considering the virtual participation in our in-person events. And that's for a few reasons. One is that Canada is a massive country, and we're trying to be inclusive to people who live everywhere, not only east to west, but also people who live up north, because people who are living in the polar region and in northern Canada really are exposed to and involved with a lot of related clinical work, whether it's environmental injuries in their communities or supporting people who are coming through on expedition, things like that. But another thing that's unique to CAWM as a national medical organization is that we're not physician centric. So we've had non-physicians on our board since we were founded and continuously through the history of the organization. And we also have non-physicians who have participated as presenters in the conference every year that it's delivered. Because when you're working in an outdoor, austere environment, there's a lot of different types of knowledge that you need to have and skills that you need to master in order to be able to do that effectively and do that safely. So sometimes we have people presenting on avalanche forecasting or we have search and rescue personnel talking about the technical aspects of approaching a rescue and emphasizing that over the clinical medical care. But you need to be able to do that and understand that knowledge in order to provide effective clinical care in those environments. And so all of that is considered part of wilderness and environmental medicine, and recognizing that we have both physicians and non-physicians and even people who are volunteering in their role doing wilderness and environmental medicine. That's why we want to keep the conference as accessible as possible and keep the information as accessible as possible as we're building the community. So we host a great in-person conference, and there's a lot of value in coming in person and doing that informal networking. But if that's not an option for you, then we're committed to continuing to offer the virtual option so that the information is available.
Attracting top healthcare talent is crucial for providing exceptional patient care, but connecting with the right professionals can be time-consuming and complex. Cherry Health bridges the gap. Our network allows you to showcase your organization, post jobs with precision and ease, and directly engage with healthcare providers actively searching for roles like yours. Whether you're an ambitious do-it-yourselfer or a seasoned recruiter, our intuitive web platform makes it easy to showcase your open roles and organize your applicants. Need a more personalized approach? Cherry Health Staffing Solutions offers dedicated recruiters to find and vet the perfect candidates for your specific needs. Build your dream team with Cherry Health. Visit www.cherry.health and start growing your team today.
I love that the content is aimed to be as inclusive as possible to as broad of an audience as possible. How would it compare to something aimed more for a non-healthcare lay person? Backcountry survival skills and first aid. Like, how would the level of the educational material differ from something like that?
We try to keep our educational material, as Dave had mentioned. So we do have accredited with the College of Family Physicians. So we do have to keep on the main stage to a level that is appropriate to meet accreditation. However, we do make sure our speakers are aware of the vast diversity in our audience. So as Dave had mentioned, we have ski patrollers, we have search and rescue technicians, we have military, we have medical students, we have nurses, we have people who actually have organizations or companies that actually teach wilderness first aid, so to that level. So we try to make sure that our talks are accessible from basic first aid level all the way up to a physician level. So our speakers are aware of that. And when we choose our speakers, we're also acknowledging that as well. So for example, we have usually a full afternoon of workshops as part of our conference. So these are like hands-on, learning how to reduce a shoulder, which is very pertinent for example, a ski patroller. But maybe a nurse doesn't want to learn about that. So we have these workshops that occur simultaneously, which allow people to go where the knowledge that they want to obtain is. So you actually have that opportunity to, if you're a first aider, for example, or a volunteer search and rescuer, and you want to learn how to make a first aid kit, that option is there. If you're a physician and you want to learn point of care ultrasound and its uses in the wilderness, that option is there. So that's a way that we make our conference very suitable for all the levels of providers that are in the wilderness. And we pride ourselves on that because many conferences do not do that. As a physician, most other conferences I attend are very physician oriented. They don't have that team-based approach and they don't allow for that, which is a gap that we see in with CAWM, and it's something that we've continued to focus on as the conference grows, that we want to ensure that we maintain that diversity and the applicability to all the providers.
I love that. It's the choose your own adventure format, whatever you might be getting into.
Absolutely. We love choose your own adventure safely.
And then we've got the event coming up, the big annual conference again in September this year, hosted, of course, in Whistler, BC, the staging area for all of the wilderness adventures. What should we expect with the event coming up? What's planned?
In September, it is from the 11th to the 13th of September. Prior to that, we do have a 2-day pre-conference as well. So our pre-conference offers more longitudinal learning. So for example, there's typically like an advanced wilderness provider type of course that's available. And we also typically have an ultrasound course that's available to our attendees as a pre-conference. Then it's the main stage event. So that takes place Friday, Saturday, and Sunday. So that's where we have our main stage speakers. our keynote as well as the workshops that we just talked about.
Are people just running around the backcountry with POCUS in their pocket? Is that common nowadays?
Jordan, you'd be surprised how many people have a handheld ultrasound nowadays. It's quite popular. In fact, you'd actually, if you look into the Everest ER, they usually have a point of care ultrasound at base camp. So people are running around with an ultrasound probe. The stethoscope is going to be completely put into a museum soon, I'm sure of it.
We've come a long way. Okay, amazing. So we got some really cool pre-conference sessions for the few days prior. And then what about for the actual event itself? We've got 2 days or 3 days of actual content?
It's approximately 2.5 days.
Okay, perfect. And then we've got seminars, we've got big room speakers. What kind of sessions, what kind of topics should we expect coming up in the main room?
So this year there's going to be, again, a wide variety of topics. So there's going to be something for everyone, kind of regardless of how you connect with or how you touch wilderness and environmental medicine. Building on what we talked about before, there's a wide variety in who's going to be coming in presenting. So the speakers at the main stage of the conference are going to include physicians. We also have a nurse and a paramedic presenting. We have a military SARTech or search and rescue technician presenting from their perspective. And then we also have some PhD academics talking about the work that they're doing. And the topics that they're going to be presenting on are going to be very broad. So we're going to hear a presentation about supporting diving operations in the high Arctic up in Canada. So not only the diving considerations, but how do you do that in a highly remote environment, and then having to consider the cold weather considerations when people come out of the water as well. We're going to have a presentation looking at considerations for cancer patients and cancer survivors participating in wilderness and mountain recreation. So recognizing where people are at in terms of their current physiology and their current physical abilities, doing an assessment of how their physiology will interact to different environments, and then really how can we empower people to get out and be active as safely as possible. We're going to be hearing a presentation about research that's been done in Canada over the last few years, looking at the experiences of women participating in Canadian search and rescue teams. So that's something that a lot of our members are going to be directly involved with. And I'm anticipating it's going to be a really interesting or very popular presentation.
This sounds like a fun one. How did things go at the 2025 event? What were some of the highlights, the favorite moments?
2025 was a really exciting event. We were back in Canmore, Alberta for that conference, and that's a location that's pretty popular amongst the CAWM members. It's our second time hosting the conference at that venue. We've had really fantastic talks. Our keynote speaker was an expert in caving, and it was very well received. We also had everything from dive medicine, altitude medicine, and we even had a workshop where we had a veterinarian come in and actually teach you about caring for your dogs in the wilderness, which was very well received and very well attended because so many of us bring our four-legged friends to the wilderness. And not even just recreationally, we also have a lot of people, for example, avalanche search and rescue, who have dogs that are working dogs. So that workshop was particularly interesting, and everyone wanted to sneak in and give the dog a little pet as well.
Sounds like a really fun format to put things.
Absolutely. We do encourage fun at our conferences, that is for certain. And there's a lot of time for networking. We always have fantastic sponsors. So we have these booths set up from great organizations that allow people to kind of see some of the equipment that's available. Some people who are doing some first aid training, as well as some other organizations that kind of support and our mission. So it's always a really great environment, very fun. Everyone walks away feeling quite happy. We've been very pleased with our surveys over the last number of years, and it's really encouraging to see a lot of familiar faces every year. They come back every year, which has been great.
And what kind of partners or sponsors are helping support the event?
So it varies from year to year. So for example, last year we were in Alberta, so it was really nice. We had Alberta Search and Rescue on site. So we do like to partner with local organizations and in ways that we can support each other. The Canadian Armed Forces has always been a great supporter of our organization and are typically have a good presence at our conference. We also have wilderness physicians who have their own companies that are present. We have equipment such as Zoll was present last year, showing us some of the great equipment that they have that we can use to provide medical care. So that's just a tasting, but every year we like to have new sponsors who have a similar mission to CAWM, and we're always open to hearing from people who would like to tell us about what they do and get within our network at our conferences.
Amazing. And then what about the extracurricular activities? I can only imagine you get a bunch of outdoorsy folks together for an event. It's not going to end at 4 p.m. and everyone just goes to the hot tub.
I mean, any conference you go to, one of the running jokes is that people are spending more time in the environment the conference is being held. So in a big city, taking advantage of big city things. And certainly people are excited about coming to the venues where we hold our conferences as well. I'm always actually very impressed how many people are still in the room at the end of the day every time we hold the conference, because the content is so good, but you can see that they're dressed to immediately go outside and take full advantage of being in the environment. And so we're going to have a lot of social events planned in and around the conference, some of them being more in a bar restaurant type area to emphasize the networking and help people meet other people in the wilderness medicine community in Canada, especially if it's your first event or you're coming by yourself. There's those more traditional events scheduled to help facilitate those networking opportunities. And then, Paula, I'm not sure if you know about any of the other social events that are planned for this year specifically.
So those are like the planned social events, but there's always a unique group of people that come to these conferences, right? So people want to be outdoors. As Dave said, it's interesting that we keep people in the room all day, because we also look at the weather when we plan this. So typically we have our conference in October, November, but if we're going to beautiful British Columbia and we're going to Whistler, we want to go when the mountain bike routes are still open. So we always kind of keep that in mind when we're planning our conferences. We don't want to be in the big cities. We want to be near the outdoor adventures. So oftentimes, even without like the scheduled social events, a lot of people will get together. Like, so someone might be interested in going for a hike or going mountain biking or going for a run. So a lot of that organically occurs as well. And we always make sure there's some time allotted for people to get outside and enjoy those extracurricular activities while they're at our conference.
Make the most of the trip down. It sounds like a fun one. Anything else we need to know about the event?
If people are more interested in the schedule and how the event goes, all of the information can be found on our website, www.cawm.ca. That's CAWM.ca.
Awesome. Well, thank you so much for joining me today. Really appreciate it. Dr. Slaney and Dr. Jerome. Thank you.
Thanks again, Jordan.